Hello, I'm Dr. Terry Allen Hayes, and you're watching my answers to interview questions given by the marketing department of the Psious Corporation. I agreed to help by offering my experience with my selection of virtual reality software and hardware for use in my clinical practice, as well as to tell you a little bit about how I've set it up in my practice for clinical use. I do hope to encourage other practitioners to consider using virtual reality in their practices and to also consider using Psious if they are. I will state this disclaimer that I have no financial or other relationship with the Psious Corporation, and I am not receiving any money for this interview. I do hope that many of you will become subscribers as I am to the platform, and I hope that you're as happy as I have been. Thank you. I am Dr. Terry Allen Hayes, and I am a licensed psychologist and health service provider in the state of Massachusetts. I attended St. Louis University in Missouri, where I was graduated with my master's degree and my doctoral degree, and I began private practice shortly after that here in Marshfield, Massachusetts. My education and my supervised training and my experience in the last 30 years has been with children and adolescents, as well as in family therapy, and that's constituted my practice up until this point 100%. I've only recently introduced virtual reality as a treatment method into my services that I do provide. I had the idea to start using virtual reality as a tool for treatment in my clinical practice last June, and since that time I've set up my practice with a virtual reality lab where I'm speaking to you from today, so that I can provide services to children and adolescents for their fears and phobias. That's a good question. Virtual reality as a treatment tool has been in the literature for a number of years now, being used as a treatment for returning combat veterans who have post-traumatic stress disorders. The Department of Defense and our Veterans Administration system have employed this treatment with great effectiveness throughout the country. The technology has spread now into the civilian part of things, and it's bringing in exciting opportunities that were very attractive to me in terms of being able to provide immersion therapy in a fun format, in a quick, effective style that would be enjoyable. I would have to give credit for the actual original concept as well as structure to a periodical titled The Psychotherapy Networker, which I read regularly as part of my clinical practice. And in the December-November 2016 edition, they had an article that outlined the use of virtual reality for clinical use, and that included providers such as Psious and others, as well as steps to put this into place in your practice. And I use that pretty much as a template for going forward. Yes, I chose Psious, a Spanish and American-based company, based on my review of their software and its comparison to other software providers. I liked that the Psious company itself was comprised of different professionals working together to provide this brand new technology for us to use in our clinical practice. I found the company to be very friendly and cooperative and motivated in helping me succeed. Some of the specific things that were on my criteria list that Psious provided were, I believe they have more environments to choose from as a practitioner so that I have more choice for interventions. And I think they have more environments that are applicable to a child and adolescent population. I think the 3D graphics are amazing, and it's in a format that's comfortable for children and is actually exciting for them, which is different than the usual approach to therapy of children with anxiety disorders. I think that the choice of environments as well as hierarchies is tremendous so that it provides the clinician with creativity and imagination and no limits on how those could be applied to helping our clients deal with their anxieties and phobias. Another criteria that I liked that Psious provided was the use of biofeedback coupled as part of their software and hardware. This is appealing to me. I would also mention two other big pluses for any practitioner who is considering this. The first is in marketing, and Psious is great about offering all sorts of free marketing materials, both printed and digital, and strategies for using them. And Psious is also great about providing free online training for their product and when new environments come out, and any specialty populations like children and adolescents. I was able to begin offering virtual reality immersion services last December, so I haven't been doing it for a long time. I do offer, through my book of fears and scary places, and this is marketing material that the Psious company helped me put together. For example, a fear of needles, fear of flying, and this is excellent for clinical education materials for new clients as well. I offer these services as a standalone treatment for phobias and fears, and that's what people are seeking services for. It's also been used as part of other therapies and can be used to support other therapists who do not use this technology. So there's a wide number of access routes to this as a standalone treatment. And I did select, since I'm a child and adolescent specialist, the environments that I think would be most useful to me in that population, and that includes the fear of darkness, the fear of animals, both insects and dogs. I'd love to see some more of those. The fear of heights, fear of closed spaces and elevators, fear of public spaces, fear of the metro. For older teens, I offer a fear of driving, fear of test taking, and certainly fear of driving is in demand. And I do offer training in mindfulness and relaxation as part of the treatment interventions as well. In case you can't tell, I'm clearly impressed with the Psious platform and how I've been able to use it in my clinical practice. It's very straightforward software, and it's easy to customize the software for interventions with any client's specific needs. The hierarchies to be chosen from are very creative and useful, and the combinations are really endless and up to the creativity of the provider. I also think it's really smart and very useful on a clinical as well as a marketing level to include biofeedback and reports about what's been done printed that can be given to a client at the end of each session. I think these two elements improve the effectiveness of the tool and the clinical use and change and the endurance of the change that it produces. The fact that this tool can be used to help a child or an adolescent master their phobia or a fear in a few sessions is quite remarkable. And the fact that kids enjoy it is a really pleasant surprise and makes it kind of easy to work with a population that is notoriously difficult because they want to avoid any kind of anxiety situation in general. So this is a really nice improvement for my clinical practice. While I haven't had a lot of clients to report to you about the effectiveness so far personally, I do have the personal experience of having a number of clients who volunteered to help me with training so that I could practice and become familiar with the Psious software and its use in an intervention. And 10 of my clients volunteered to help me do that and to give me feedback about what the experience was like. I have to tell you that just with one session exposure, there were some pretty remarkable tales already. One person with a fear of needles said that they had never looked at an extraction before and said that they were encouraged about doing so in the future. One child who was worried about trains took the metro and was able to actually master that the first time that she took a train, and was very proud to report that she handled it using strategies that she learned in that one session. That's also been applied to an adult as well as a child in their fear of dogs. Both were impressed with themselves as well as with the software in how much they were able to handle and how much better they felt afterwards. That's a good question, and it's probably a little soon to tell, but I'm pleased so far because the amount of money required to set up these services in a practice is very small, and it probably takes a little more time to make sure that you've got the environment and the support and administrative procedures ready to go. Certainly the primary investment is going to be time that you need to spend learning the program. It's relatively easy and, as I said, straightforward, and it is fairly quick to master. And Psious does offer, as I said, online learning experiences to help with that. The second priority of investment is setting up the office itself. Psious does offer a loaner kit to begin if you're just reviewing or wanting to learn the software before you want to make a commitment. But the hardware itself is not expensive. The Oculus glasses and the smartphone, the biofeedback connections are fairly inexpensive. I did want to enhance the experience of immersion, so I went beyond headphones to create an environment in this room which has surround sound, and it has